Hello everyone, hope you're doing safe and sound. As this COVID-19 pandemic has had a very huge impact on our human lives, and we all know how sad reality it is today. So, we NSS volunteers of the Tamagi College of Engineering have thought of an idea to present to you this video on the topic different variants of SARS-CoV-2, that is, different variants of COVID-19. We have tried our level best to give you the information about these variants, as it is very important to know about such variants which are spreading rapidly in today's world. So hope you like the video and please watch it till end. Interrupting routine healthcare services, disruptions to travel, trade, education and many other factors including societal functions too. And more broadly, having a negative impact on people's physical and mental health. Since the start of COVID-19 pandemic, WHO has received several reports of unusual public health events possibly due to variants of SARS-CoV-2. WHO routinely assesses if the variants of SARS-CoV-2 result in changes in transmissibility, clinical presentation and severity, or if they impact on countermeasures including diagnostics, therapeutics, and vaccines. Previous reports.
On 18 December, national authorities in South Africa that announced the detection of new variants of SARS-CoV-2 that is rapidly spreading in the 3 provinces of South Africa. South Africa has named this variant 501Y.V2 because of N501Y mutation. UK also has the same mutation. Phylogenetic analysis has shown that 501Y.V2 from South Africa are different virus variants. In the week beginning 16 November, routine sequencing by South African health authorities found that this new SARS-CoV-2 variant has largely replaced other SARS-CoV-2 viruses circulating in Eastern Cape, Western Cape and KwaZulu-Natal provinces. While genomic data highlighted that the 501Y.Y2 variant rapidly displaced other lineages circulating in South Africa, and preliminary studies suggest the variant is associated with a higher viral load, which may suggest potential for increased transmissibility. This, as well as other factors that influences transmissibility, are subject of further investigation. Moreover, at this stage, there is no clear evidence of the new variants being associated with more severe diseases or worse outcomes. Further investigations are required to understand the impact of specific mutations on viral properties and the effectiveness of diagnostics, therapeutics, and vaccines. These investigations are complex and require time and collaboration among different research groups. These studies are ongoing.
Prevention advice and communication for the public should be further strengthened, including precautions to protect yourselves and others, such as physical distancing, wearing a mask, keeping rooms well ventilated, avoiding crowds, cleaning hands, and coughing into the bent tissues. Moreover, infection prevention and control guidelines and measures should reinforce, including use appropriate personal protective equipment when caring for the people suffering from an acute respiratory illness. Practice frequently hand washing, especially after direct contact with ill people or in the environment. Enhance stands infections prevention and control practice in hospitals, especially in emergency. And if our test is positive and there is no serious symptoms, then we stay isolated place is better. In all circumstances, essential services like cargo transport for essential supplies such as food, medicines and fuel identified by the countries should always be prioritized and facilitated.